The world watched in disbelief. A virus, microscopic in size, brought humanity to its knees. COVID-19 exposed the fragility of global health systems, overwhelmed hospitals. A scramble for supplies and rising fear painted a chilling picture. Yet this invisible enemy also ignited resilience. Scientists raced against time, achieving breakthroughs in vaccine technology. Communities united, supporting frontline workers and embracing public health measures. The COVID-19 pandemic served as a wake-up call. It underscored the need for robust global health infrastructure. We can no longer afford to be caught off guard. The time to act is now. This is a call to action for governments, organizations, and individuals worldwide. We must learn from COVID-19 and forge a path toward a healthier future. This is a shared responsibility, demanding global cooperation and commitment. The pandemic exposed both strengths and weaknesses of global health systems. It revealed the resilience of some nations and the vulnerabilities of others. Our infrastructure for handling health emergencies was often inadequate. The pandemic forced nations to evaluate their preparedness. This wasn't just about hospital beds or ventilators. It was about public health infrastructure. Lessons from COVID-19 underscore the need for a proactive approach. Investing in pandemic preparedness is an imperative. The virus ignored borders, calling for a unified global response. Despite devastation, the pandemic revealed human ingenuity and resilience. The rapid development of vaccines was a scientific triumph. Scientists globally shared data and expertise in unprecedented solidarity. Countries like South Korea and New Zealand implemented swift actions containing the virus. Early and aggressive action proved crucial. Strong public health leadership and clear communication were key. The pandemic accelerated telehealth, expanding healthcare access. Virtual consultations and remote monitoring became necessities. Some nations struggled, revealing deep-seated inequalities. The pandemic exposed fragile healthcare systems in low and middle-income countries. India's second wave highlighted the consequences of an overwhelmed system. Hospitals ran out of beds, oxygen supplies dwindled, and the death toll soared. The crisis underscored the need for increased healthcare investment. Marginalized communities bore the brunt of the pandemic's impact. Disparities highlight the need for a more equitable global health approach. Infectious diseases demand a coordinated global response. mRNA vaccines emerged as a beacon of hope. These vaccines offered a powerful new tool against infectious diseases. Unlike traditional vaccines, mRNA vaccines use a genetic blueprint. This novel approach marked a paradigm shift in vaccine technology. Within a year, Pfizer-BioNTech and Moderna's mRNA vaccines received authorization. Their speed and efficacy showcased immense potential. mRNA vaccines ignited interest in combating other diseases. This breakthrough could revolutionize global health security. mRNA vaccines ushered in a new era of vaccine development. They offer rapid development, high efficacy, and customizable design. Rapid design is crucial against novel viruses. However, ultra-cold storage poses logistical challenges. Ensuring equitable distribution remains critical. Vaccine hesitancy, fueled by misinformation, is a significant threat. Addressing hesitancy requires clear communication and debunking misinformation. Despite challenges, mRNA vaccines are invaluable against evolving pathogens. Ensuring equitable distribution and fostering public trust are paramount. The pandemic exposed stark inequities in vaccine access. High-income countries secured early doses, leaving others struggling. Addressing inequity requires collective effort from all sectors. Initiatives like COVAX represent a step in the right direction. Building public trust in vaccines is equally crucial. Combating hesitancy requires open dialogue and evidence-based information. Engaging trusted community voices can build vaccine confidence. Vaccines are vital, but not a silver bullet. Building resilience requires a multi-pronged approach. Strengthening healthcare systems, fostering collaboration, and addressing disparities are key. Robust surveillance, laboratory capacity, and medical supplies are critical. Investments in research, training, and preparedness are essential. The pandemic exposed the limitations of a reactive approach. We must anticipate threats and strengthen defenses. A proactive approach is necessary for pandemic resilience. Strengthening global health security is a collective self-interest. Infectious diseases know no borders. Investing in health systems globally is smart and necessary. This requires sustained commitment from all sectors. Increased funding and equitable access to medical technologies are crucial. The pandemic highlighted our interconnectedness and shared responsibility. Global health security is an investment in a safer future. The time to act is now, before the next threat emerges. The true strength of healthcare systems lies in their workforce. Empowering healthcare workers is paramount to building resilience. This begins with quality education and training programs. Ongoing professional development is essential. A supportive work environment prioritizes their well-being. Addressing the global shortage of healthcare professionals is crucial. Innovative recruitment and retention approaches are needed. Valuing healthcare workers' expertise strengthens the health system. No nation is an island in a global health crisis. Interconnectedness demands a united front. Global cooperation is a necessity. Sharing information, resources, and expertise strengthens defenses. Early detection and containment are crucial. Collaboration is about recognizing our collective strength. Ensuring equitable access to medical supplies is vital. Lessons from the pandemic must inform future health governance. In an increasingly interconnected world, international organizations play a pivotal role in coordinating global health efforts and providing a platform for cooperation. The World Health Organization, or WHO, as the leading global health authority, is uniquely positioned to provide leadership, technical expertise, and a framework for collective action. Their mandate is to promote health, keep the world safe, and serve the vulnerable. This includes providing guidance on disease surveillance, outbreak response, and public health measures. It also involves coordinating research efforts, developing global health standards, and supporting countries in strengthening their health systems. The WHO's role is not to dictate policies to nations, but to provide evidence-based recommendations and facilitate collaboration. Beyond the WHO, other international organizations such as the Global Fund to Fight AIDS, tuberculosis and malaria, Gavi, the Vaccine Alliance, and the Coalition for Epidemic Preparedness Innovations, or CPI, play crucial roles in mobilizing resources, supporting research and development, and ensuring equitable access to essential health interventions. The effectiveness of these international organizations depends on the support and cooperation of member states. This includes providing adequate funding, adhering to international health regulations, and engaging constructively in global health diplomacy. Strengthening these organizations, ensuring their transparency and accountability, and empowering them to fulfill their mandates is essential for safeguarding global health security. Just as military strategists conduct war games to prepare for potential conflicts, so too must the global health community engage in pandemic simulations to test our preparedness for future health emergencies. These simulations provide a safe and controlled environment to identify vulnerabilities, rehearse response plans, and strengthen coordination mechanisms. Pandemic simulations can involve a wide range of stakeholders, including government agencies, healthcare providers, public health experts, and international organizations. They can range in scope from tabletop exercises where participants discuss hypothetical scenarios to large-scale simulations involving thousands of individuals and real-world deployments of resources. The value of pandemic simulations lies in their ability to expose weaknesses in our systems and highlight areas for improvement. By identifying potential bottlenecks, communication gaps, and resource limitations, we can proactively address these challenges and strengthen our ability to respond effectively to real-world health emergencies. Regularly conducting pandemic simulations, incorporating lessons learned from previous outbreaks, and continuously adapting our response plans based on new knowledge and emerging threats are essential components of a robust global health security framework. These simulations are not about predicting the future. They are about preparing for the unknown and building our capacity to respond effectively to whatever health challenges may arise. The COVID-19 pandemic has tested our resilience and exposed our vulnerabilities. What lessons will we carry forward? Will we emerge stronger and more united, or let lessons fade, leaving us vulnerable? The legacy we leave hinges on today's choices. We must translate hard-won lessons into actions that strengthen global health security. It's a shared responsibility demanding active participation worldwide. Pandemics are social, economic, and political phenomena. They expose inequalities and test our societies. Building resilience requires addressing vulnerabilities and fostering solidarity. We are all interconnected. The health of one affects all. The choices we make today will shape the world for future generations. The path forward is clear. Building a future free from pandemics requires a shift in our approach to global health security. It demands international cooperation and investment in public health. This is not a time for complacency. COVID-19 continues to evolve, posing new threats. Other infectious diseases and antimicrobial resistance remain significant risks. The pandemic has given us a chance to build a resilient future. This is a call to action for everyone. Support global health, advocate for funding, and demand accountability. Educate about vaccines and public health measures. Challenge misinformation and promote trust in science. Embrace global citizenship and work together. The time to act is now. Our shared destiny depends on it.